Elton John, Zayn Malik, Demi Lovato, Kesha, and Lady Gaga. These are all names I'm sure you've heard before, and they've all opened up about their struggles with an eating disorder, as reported by People earlier this year. With that being said, 30 million people in the US suffer from an eating disorder, as reported by Hudson and co-authors in 2007. 10 million of those are men. So, you've most likely come in contact with someone with an eating disorder without even knowing it. After becoming more informed about eating disorders, hopefully you will be more equipped when discussing this topic in the future or when interacting with others. With this in mind, I've thoroughly researched each eating disorder, studied it in 2 of my classes, and read testimony from an individual who has experienced an eating disorder firsthand. Moreover, the 3 primary eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder, all of which can be fatal if left untreated. First, I will discuss anorexia nervosa, then bulimia nervosa, and lastly, binge eating disorder. First, I will be talking about anorexia nervosa, which is the 3rd most chronic illness in adolescents, as reported by Pediatrics Child Health in 1998. Anorexia is a life-threatening mental illness characterized by its severe symptoms, different forms, and medical complications. Symptoms of anorexia nervosa include crippling fear of weight gain, distorted perception of weight, restricted food intake, avoidance of food, obsession with thinness, excessive exercise, lethargy, inability to focus, and inability to maintain a healthy body weight, as reported by the National Institute of Mental Health in February 2016. Additionally, the stereotypes surrounding anorexia can be damaging, and that goes with any eating disorder, because you can't always see an eating disorder. And that was a remark by Lexi Mannion, who has experienced anorexia firsthand. Amenorrhea, which is the absence of a menstrual cycle, continues to be a criteria for anorexia, but that disregards the men that suffer from this disorder as well. Additionally, there are 2 types of anorexia nervosa: restrictive subtype and binge purge subtype. As the restrictive subtype suggests, it includes an extreme restriction of food intake. The binge purge subtype also restricts food intake, but may also show purging behaviors, and they may also engage in binging. The physical impact anorexia has on the body is often permanent and can lead to medical complications, thus explaining why anorexia has the highest mortality rate out of all the mental disorders. The consequences of anorexia are osteoporosis, muscle wasting, brittle hair and nails, dry skin, constipation, low blood pressure, slowed pulse, damage to the structure and function of the heart, brain damage, multi-organ failure, infertility, and death, according to the Mayo Clinic as of 2018. Next, I will be discussing bulimia nervosa, which is just as dangerous as anorexia. Bulimia nervosa is a mental illness that is characterized by its severe symptoms and medical complications. Symptoms of bulimia most often include episodes of binge eating, followed by varied forms of purging, and those purging can be laxative use, vomiting, exercise, or fasting. Unlike anorexia, people with bulimia can be normal weight or even overweight, which makes the eating disorder hard to identify. These binge purge behaviors become compulsive over time, leading to an obsession with food, as stated by the National Eating Disorder Collaboration in 2020. Additionally, someone with bulimia will go to extreme measures to keep their behaviors secret, which delay detection and therefore treatment of the eating disorder. The behaviors associated with bulimia nervosa can lead to serious physical complications. Bulimia nervosa can cause irreversible damage to the body, including electrolyte imbalance, tooth decay, gastrointestinal issues, dehydration, acid reflux, inflamed throat, stomach ulcers, rupture of the esophagus, increased risk of infertility, osteoporosis, and irregular heartbeats, which increase the risk of heart failure, as reported by the National Eating Disorder Collaboration as of 2020. Lastly, binge eating disorder, or BED, includes repeated instances of binging, but without the purging that is present in bulimia. BED is characterized by a variety of symptoms and health consequences, and it is the most common eating disorder in the United States, which was reported by the National Institute of Mental Health as of February 2016. The behaviors displayed by people with binge eating disorder can result in short-term effects, which include bloating, abdominal pain, nausea, and acid reflux. But if left untreated, binge eating disorder can cause long-term effects, such as hypertension, type 2 diabetes, obesity, depression, osteoarthritis, and kidney failure, according to the National Eating Disorder Collaboration as of 2020. In conclusion, eating disorders are treatable mental illnesses that are prevalent in today's society. The 3 eating disorders that I discussed today are anorexia nervosa, bulimia nervosa, and binge eating disorder, all of which can be fatal if left untreated. Eating disorders are often stigmatized as they are misinterpreted as lifestyle choices. This leads to additional guilt and shame in the individual, as they are often stereotypes, as I discussed earlier, associated with eating disorders. And that goes for any mental illness, unfortunately. 30 million people. That is about the population of Texas, a little bit more even. And that's only in the US. 70 million people worldwide suffer from an eating disorder. This is not something that just affects teenage girls. This is an epidemic. Thank you.